Health is often seen as the most important part of a person's well-being, and it also has a big impact on a country's growth and prosperity. Health is more valuable than any materialistic gains. As Mahatma Gandhi said, health is real wealth, not gold and silver. This phrase makes a point of showing how important it is to protect and improve health, especially for the whole country. When considering nations like Kazakhstan with its vast geography and diversified people, Gandhi's remark takes on new significance. Kazakhstan has its own set of healthcare problems and unfair practices because of its diverse people and the big differences between cities and rural places. This essay goes into great detail about how challenging it is to get medical care in Kazakhstan, especially in the country's rural areas. The research question that guides this investigation is: what are the main problems that keep people in rural and urban Kazakhstan from getting good medical care, and how can these problems be successfully fixed? Referring to this complex research question, the essay's main arguments become clear. There is no doubt that socioeconomic factors like wealth or political ties affect the access to healthcare, but the real issue goes beyond the money. It makes sure that everyone, no matter their income or where they are from, has the same and endless and fair access to high-quality medical care. In the following part, we'll get into the specifics of this case by giving an empirical evidence and insight that will illuminate the path forward for Kazakhstan's healthcare landscape.
An important concern that Kazakhstan faces in its healthcare system is an equal distribution of medical specialists across its urban and rural areas. According to a study conducted by Katsaga, there is a notable contrast in the accessibility of healthcare professionals when comparing city centers to their countryside. Urban regions, often the heart of medical education and higher-paying job opportunities, are full of healthcare professionals. Putting into numbers, the urban parts of the country show an excellent concentration of physicians of 583 doctors per 100,000 people. On the contrary, empirical evidence shows that the rural areas, which are home to over 40% of Kazakhstani population, face a more complicated position. They have much fewer physicians, with only 141 doctors available per 100,000 people. Despite their sizable numbers, the populace who reside in rural regions is served by a mere 17.13% of the whole nation's physicians. Delving deeper into the challenges of these results, the unequal distribution of medical specialists leads to several negative effects on the rural health area. With fewer doctors available, people in the countryside often have to wait longer to get help, have less interaction with doctors, and moreover, the necessity to travel far distances for specialized care. The shortage of healthcare providers also places immense pressure on existing rural doctors, leading to potential burnout and further compromising the quality of care. Additionally, the reduced access to qualified medical professionals naturally translates to inadequate medical services for these communities, elevating health risks and potentially worsening existing health disparities. Closely intertwined with the mentioned problem is the uncontrolled violation of patients' rights within the healthcare ecosystem. Kazakhstan lacks a streamlined, dedicated channel for distressed patients to voice their concerns, report rights violation, and seek timely compensation. Such systems in place are overburdened, dealing with many cases beyond healthcare. This scattered approach inevitably leads to inefficiencies, with many genuine injustices getting lost in a bureaucratic maze or facing prolonged delays. Moreover, the survey results reveal that 41% of respondents in rural areas believe their rights as patients were violated, slightly higher than the 38% in urban areas. Adding to this, a staggering 93% of respondents did not report these violations, citing various reasons, including the belief that it would be time-consuming, difficult to prove, or simply futile. This lack of reporting underscores a significant gap in the protection of patient rights and highlights the need for better awareness and easier reporting mechanisms.
Another important problem with Kazakhstan's healthcare that must be mentioned is that in rural areas not everyone has the same access to basic drugs. A complex study in 2021 found that 4,000 rural towns across the country don't have a single drugstore, even though there are 9,000 pharmaceutical service facilities across the country. Moreover, However, recent survey results indicate that the average distance to the nearest pharmacy in rural areas is about 5 kilometers. This contrasts with urban areas where the average distance is just 500 meters. 14% of respondents in rural areas have no pharmacy at all. Additionally, 41% of respondents in rural areas confirmed cases of lacking necessary medications at their local pharmacies, slightly lower than the 45% in urban areas, highlighting a widespread issue in medication availability. People who live in rural areas, which is 40%, often have to drive a long way to get to a drugstore. This isn't always possible because these areas are very large and have troubles with getting around. When you look at the results in the bigger picture of healthcare access, you can see that this big difference is caused by a large number of issues. The fact that many rural towns are far away from each other makes it hard to set up and run shops. It takes a long time and costs a lot to ship medicines to these faraway places, which might stop many drug companies from running their business. It is also important to remember about limited cash resources of people living in rural areas. When money is tight, some private drug groups might not want to open their stores in places where they won't get much back on their investment.
Another considerable challenge shadowing Kazakhstan's healthcare system, especially in rural territories, is its underwhelming medical infrastructure. Research conducted in 2022 highlights many rural regions lack essential medical facilities. This is further substantiated by recent survey findings, which show that satisfaction with medical infrastructure is notably lower in rural areas, with an average rating of 2.79 on a 5-point scale compared to 3.43 in urban areas. The implication of this infrastructural issue is quite profound. Residents in these areas find themselves in situations where they have to undertake often long, unbearable journeys to access primary care, which is an essential health service that ideally should be available within proximity.
At the heart of our investigation lies a crucial research question. What are the obstacles preventing people in urban areas of Kazakhstan from accessing quality medical care? And the second question is how this might be effectively solved. We suggest that it should be Kazakhstan's mission to guarantee that all people have equal access to healthcare regardless of their geographical location or, financial status, even though both of these factors play an unquestionably major role. Several of the results of our research were truly disheartening.
First, there is an obvious gap between urban and rural areas in terms of the number of qualified medical experts available to their respective communities. The recent survey we conducted echoes this, with respondents identifying a lack of qualified specialists, particularly in surgery, as a main healthcare problem. Secondly, there is a desperate need for a well-organized, dedicated administration to address and sort out violations of patients' rights, which in their current state could be more efficient and responsive. Additionally, respondents expressed concerns about bureaucracy, low digitalization, and corruption, further complicating patient rights issues. The lack of pharmacies in many rural areas of Kazakhstan compounds the country's other glaring problem: a lack of access to crucial medicines, as well as a shortage of good medical equipment and funding issues. Finally, we contend that it is critical to recognize the absence of medical infrastructure in rural regions, which sometimes forces patients to travel great distances merely to get basic care.
In addition to what has been mentioned by the survey respondents, pediatrician Heinz Eleonora Alexandrovna, who has 26 years of experience, has her suggestions for improving the medical system in Kazakhstan.
Оценивая качество и доступность медицинской помощи в городе, хочу сказать, что она на достаточно высоком уровне. Наше население имеет выбор, альтернативу – вызвать скорую помощь 03, или пойти в поликлинику, или вызвать врача на дом, или пойти в частный медицинский центр. Охват медицинскими услугами городского населения приближен к 100%, что, конечно же, очень хороший показатель даже на уровне мировой статистики. Для изменения или улучшения медицинской системы мне думается, что необходимо повышать качество подготовки специалистов на уровне вузовского образования, улучшать социальный пакет медработников, оказывать поддержку молодым врачам и медсестрам. За молодыми специалистами будущее. Медицинские учреждения нуждаются в хорошо подготовленном и заинтересованном персонале.
Another head physician at the private clinic shared her concerns regarding training medical students. According to her, the current situation had worsened over time. This underscores the critical importance of enhancing the quality of medical care through improved professional training at universities.
Что сейчас происходит, вы знаете, честно говоря, меня немножко шокирует то, что экзамен по анатомии можно сдавать тестами. Или там по каким-то специальным медицинским предметам можно сдавать тестами. Мы сдавали экзамены либо в анатомическом зале, либо у постели больного. То есть наша задача была поговорить, расспросить, посмотреть больного, анализы и так далее. И в итоге экзаменационная оценка зависела от того, насколько хорошо ты выполнил все вот эти вещи. Но когда ты сдаешь экзамены тестами, наверное, ты перестаешь видеть пациента. Не надо забывать, что работа врача – это не просто глубокие знания медицины, это еще и работа с людьми. Задача врача не просто подобрать правильное лечение, но и мотивировать пациента к исполнению рекомендаций врача. Поэтому мне бы хотелось, чтобы все-таки вернули систему экзаменов, которая была у нас раньше. Очень важный аспект – это учить врачей разговаривать с пациентами. Это очень важно, потому что от того, как вы общаетесь с людьми, которые пришли к вам за помощью, будет зависеть то, как эти люди в дальнейшем будут жить со своим заболеванием.
The mentioned issues can offer a clear roadmap for interference, and moreover, Kazakhstan can improve the state of healthcare and serve as an example to other countries if it acknowledges and takes concrete steps to overcome the stated obstacles. A reformed, fair healthcare environment in Kazakhstan could serve as a beacon representing the pursuit of universal healthcare access, which is a fundamental human right.